Okay, so it sounds like Uso's doing um, better. But I mean, I'm sure he has a ways to go. But it sounds like there's a pretty significant change.
Hmm.
Is he urinating on his own, or are you still having to squeeze his bladder?
I'm still having to squeeze his bladder, but when I do it, I'm able to get more out of it.
Okay. And does he ever start to like take over, like he's starting to go, or when you stop pressing, it kind of stops?
No, I haven't really seen anything like that. I don't see any flexing of it.
Um, so when he had a bowel movement, I know you said he had a normal bowel, like a formed bowel movement. Did he just have an accident, or did he do it outside?
He did it while we were walking.
Did he seem like he knew that he had to go, or did it seem like it was just coming out?
Yeah, I think he was trying to, cause he'll kind of get into a like squatting position. He'll
Oh, good.
start doing that, and I can see the butt flexing a little bit.
Okay.
So I think he is trying, but let's say for that solid poo, it took about 1 to 2 minutes for it to fully fall out.
That's okay. I mean, some of that could be just like anesthesia and drug related. Not that he still has anesthesia in his system, but like there, he has a lot of things that might make his GI motility like not good. Um, he's not moving around as much as he normally would. And just like movement and exercise, kind of stimulates your GI motility. Um, and then he, was under anesthesia, and that can make it like really slow down. And then stress can do that too. And then the metronidazole that I was giving him, that he's taking. So I'm not surprised that it took him a few days to go, and that it was like the first time he went, it was a little hard for him to go.
Okay.
Not yesterday, but the day before, I sent like a updated referral letter, and I attached the MRI results and the spinal fluid results, and then that went to your regular vet too. But basically, the results, he did have some inflammation in there, but then they also saw some hemorrhage in there, some bleeding in there. And based on that combination and the fact that they didn't see any organisms, bacteria, anything like that, they did think that the findings were consistent with the FCE, the embolism that we talked about.
Mm-hmm.
Um, so, I mean, those spinal fluid results could also be consistent with an inflammatory type disease, like an autoimmune disease or something like that. But based on his clinical picture and the fact that it came on like so suddenly, I think that, and the fact that there was hemorrhage in there, I think it's probably the embolism.
Okay. Which is like, is it kind of like a pinched nerve?
It's not a pinched nerve because nothing's being compressed. It's just that it's almost like a stroke to the spinal cord, where there's like lack of like something blocks the blood supply to the spinal cord, and then they have this all of a sudden, symptoms, and then over time their body kind of compensates, and they sometimes, they will improve, but sometimes they're left with some residual weakness, just like a person that say has like a stroke, their brain, where they might, slowly improve over time. Like it comes on suddenly, and then over time there's slow improvement. But sometimes they're left with some residual symptoms.
Okay.
Sometimes not. But the fact that he's improved, like noticeably improved in this short a period of time, is super encouraging.
Okay.
I mean, it probably doesn't seem like a short period of time to you because you're doing all the work.
Right.
But it actually, if you think of like, basically he's sustained an injury to his spinal cord. It's not from like a trauma or being hit by a car or anything like that, but that, embolism caused an injury to his spinal cord. and think of how long it takes for like, a person to recover sometimes when they have a spinal injury. So
Right.
his improvement has been pretty quick.
Okay.
So I think that's super encouraging. Do you think that he's still painful?
Mm, not
Or do
as
you think it's
much. Not
just
as
more,
much because
awkward?
yeah, because he can drag himself pretty far, Dr. Marie. Like like a good, I don't know, 20 yards easy. He's ready to run
Okay.
mentally, and I think the only time he feels
Okay.
pain when he's trying to lay down because his legs are getting in the way of him trying to get
Yeah.
into the right position, and a certain angle will trigger like pretty. It sounds pretty painful.
Okay. Um, if that's the case, then I think that we should keep him on the steroid dose that he's on for a little bit longer. Yeah, let's keep him on one every 24 because I don't want him to have too many side effects from the steroid.
Okay.
So I want to keep him on kind of like the low end of the dose.
Okay.
Are you still giving him all of the other? Are you giving him having to give him the gabapentin?
That's the only pain med we're
possible?
giving him right now, and I'm doing it twice, 2 pills at night, and then in the morning.
Okay, and then he's not needing the tramadol or the muscle relaxant.
Which one should I use if I need him to calm down? Cause like he's getting more antsy, and more vocal. So is there something that make him like if I had to choose
I,
one to kind of get him to relax and go to sleep? What would?
um, I, I guess each dog responds to them differently. So I would probably start with the muscle relaxant
Okay.
so that makes him a little bit just kind of sleepy
Okay.
if he's moving around too much. And if that has no effect on him and he's still like super alert, then the next time try the tramadol. Because every
That
dog's different
tramadol.
with how they recover those.
Okay.
And I think we just stay in the course.
Okay.
But I think this is encouraging. It's just I know it's a lot of work in the day to day for you guys right now, but at least we're seeing some improvements. I think that's really good.
Okay.
So I mean, it would be nice for me to see him again, but I think that it's premature for me to do that, and it's not going to change what we do. And especially given how worked up he gets at the office and the distance, I think that we can kind of talk by phone at the moment, and just because I'm not going to probably change anything based on his exam as long as he's going in the right direction.
Okay.
So let's just, why don't I plan to touch base with you maybe like early next week?
Okay. Sounds
And then,
good.
obviously, if he's having any kind of a problem or new symptom or anything, then let me know.
Okay, I will. I'm really thankful for you and how um, you're just with me throughout this whole experience.
Yeah, well, it's really stressful. And when you have a dog that's really big like that and, he can't move, it's physically a lot of work and it's like emotionally exhausting, especially when you don't know what's going to happen.
Yeah.
So I know it's like a really stressful thing to go through. And I'm really happy that he's going in the right direction. And he's really on a very low dose of steroids for his body weight. So that is encouraging because it means that it's most likely like that his body is getting better. It's not just more masking things with the steroids.
Okay.
I think I'm hopeful that he'll continue to improve.
Me too. I remember when we talked a couple days ago, I was really doubting everything, and things have changed.
Good, good. Well, I'm glad you stuck it out, and I was hoping that you would because I could tell that you were like not convinced that he could improve, and so I'm glad that he's he is improving and that you've put all this work into it.
Thank you, Doc. It means a lot.
Yeah. I'll talk to you next week, sometime, early to mid next week, earlier in the week, and then just call if anything changes, okay?
Okay, sounds good. Thank you.
All right. Bye.
All right, bye. I'm exhausted, you guys. I really feel for the people who are going through the same thing that I am right now, or have a kid that, needs full-time assistance. I really feel for them. It's this isn't easy. Thanks for your help today, babe.